I get the attire right.
Good afternoon. Good afternoon.
How are you, Damon?
I'm doing well. How about yourself?
Doing well. Doing good. And Tanya, just FYI, the video wouldn't play from the PDF, so I'll have to kind of jump from one screen to another, I guess.
Hey, Cole, can you do me a favor? Can you give me back host control? I'm going to make you a co-host. I need to switch something. Can you just make me
Sure. How do I do that?
go to where you see your name and it says more, and then you can check on the.
There we go.
And then just.
Mute my audio, stop video, pin, spotlight, hide self view.
Never mind. I got it. I see what
you got. It? Okay. Oh, there. Okay. It says you're the host now on my end.
Yeah.
Okay.
I just made you a co-host, so you're good to go.
Got it. So just to make sure, I'm going to hit the share screen button to see if it just jumps up and make sure
it should allow you to as co-host.
Get the right stuff going on here.
Yeah, and Joe and Tanya, good afternoon. I've made you both co-hosts as well, just in case one of you all decide to share your screen or need to share your screen.
Okay. Cole, you're still driving for us?
Yep.
Okay, perfect. Thank you.
So we do that.
Yep, we can see your screen now, so you're good to go.
Okay. Now, should I leave it like this to get started, Damon, or did you want to start and then hand it over?
I'll open up with a brief intro, and then I'll intro you all. You guys can start, but you can leave that up for now. That's fine.
Okay.
My intro is literally under a minute, so.
Great.
Yep.
Switch these over real quick. You guys can see that again, right?
Yep, looks good.
Okay.
Yes.
We'll get started in a couple of minutes. Just going to allow some more folks to log in, and we'll get started in about 1 to 2 minutes. Welcome once again to everyone. Give us about another minute and let a few more folks trickle in. Then about 1:01, we'll get started. All right. Good afternoon to everyone. Welcome to the Bloom Health Partners webinar. We're excited that they're joining us today. My name is Damon Hoyle. I'm the Senior Operations Project Manager here at Texas Education Agency, helping to manage the COVID-19 testing program. I'm joined today by my colleagues at the Texas Department of State Health Services, also known as DSHS, and we collaborate on the Reopening Schools Grant, which is a grant that the CDC provides to all the states. And under that grant sits the K-12 COVID-19 testing program. And so we're excited to be joined today by Bloom. I'm going to turn it over to them in just a second. Just two quick reminders. This session is being recorded. So for anyone that didn't make the session or for anyone that wants to go back and review it, it will be posted on the TEA website within the next 1 to 2 business days. We're also going to post a link to the slide deck that they share as well for your reference. So that's the first reminder. And then the second reminder is at the end of the session, we will have a Q&A segment. So please use the Q&A feature at the bottom of your screen or the chat feature to send in your questions throughout so that Bloom, TEA, or Dishes can answer your questions. With that said, I'm going to turn it over, I think, to Cole, Joe, or Tanya, or Amanda. Welcome all of you all from Bloom, and we can go ahead and get started.
Thank you very much, Damon. And also really want to thank both the TEA and Dishes teams for your continued efforts in supporting this program, not only last year on short notice, but also continuing to support the program going into this next school year. We're excited to remain a part of the program going into this next 22-23 school year. And we also want to thank the participants joining us on the webinar here today. We hope that you find this informative, and we're looking forward to a Q&A session after this. So my name is Cole Lysott. I'm the co-founder of Bloom Health Partners, and joining me today are Joe Kurland, who's an infection preventionist at Children's Minnesota, and he's on our Bloom Health Partners Board of Advisors, Tanya Avent, Bloom's Field Operations Manager, and Dr. Amanda Natalizio, the Laboratory Director. Got a brief video here. So sorry you all didn't get to catch the audio there. While we do a lot of work with the television and film industry, apparently we don't have the professional audio here on Zoom. So anyhow, for the last over 2 years now, Bloom has supported hundreds of organizations in a diverse set of industries, whether it's production line workers at food manufacturing companies, employees at airlines, critical operations centers, film and television studios for their cast and crew's daily testing requirements from the Screen Actors Guild and other guilds, and even concerts and live events like the Super Bowl. Bloom has a lot of experience delivering a diverse set of solutions based on each unique organization's testing needs. And we've had the ability to adapt to the needs of any organization, and school districts and even individual schools are no different. Last year, we had the opportunity to participate in this program here in Texas. We were onboarded as a vendor halfway through the school year in January. And since just January of this year, we ramped up to providing testing, individual rapid antigen tests, PCR tests, and even Bloom nurse staffing to over 200 school districts in the state of Texas. Our nurses have the ability to staff locations, including district administrative buildings. We have drive-through testing sites, individual school campuses, and even testing sites for each feeder at a feeder school within the district. Additionally, we are one of 2 vendors in the state of Alabama that provided testing for their K-12 program last year. We had almost 10,000 students whose parents consented to weekly PCR screening testing. And our team on the ground there consisted of over 115 nurses who visited 110 schools on a weekly basis for PCR screening testing. And our teams were hitting about 2 to 3 schools per day per team. So, you've got an example of one program, in Alabama where we did regular weekly screening testing. here in Texas, we did a little bit of everything, providing, not only shipping out rapid antigen tests, and PCR kits, but also having our staff on site. So as you can imagine, that requires a lot of logistics and operational expertise, which we have plenty of that, but we're also backed by a great team of medical technology and science experts. Some of our board members and board of advisors include, from left to right here, Dr. Demisha Kalia, who's the Chief Medical Officer at General Electric Company, former Deputy Secretary of HHS, Eric Hargan, Jessica Federer, who's the former Chief Digital Officer of Bayer, helps out with our technology platform and stack, Dr. Alexander Stemmer, had research published in the New England Journal of Medicine related to COVID-19, Dr. James Shepard, and in fact, we have joining us here today, Joe Curlin, infection preventionist with Children's Minnesota. And I'm going to hand it over to Joe here to kind of inform everybody a little bit about what they've learned in the medical profession about not only COVID, but as it relates to COVID affecting children over the last 2 years. So Joe, I'm going to hand it over to you.
Thank you, Cole. So as Cole just said, we've learned quite a bit about COVID over the last several years, and this is a new virus, and we're experiencing science basically in real time. So the guidance that we've offered has changed over time. The therapeutics, the vaccines, this is a constantly evolving process for us, and it's really been, in my profession, head spinning at how quickly some of this has been happening. I can't imagine what it's been like for the education profession across the country to try to adapt to this in real time. I have 3 kids. We have them attending elementary school and middle school here in Minnesota. So it's been really admirable to see what all the teachers can do to make education work. But what we have learned is that outbreaks really can happen anywhere. And it's not one group of people, it's not one age population. This is something that can happen anywhere. And if you're not vaccinated, if you're not protected against this virus, it can really make you very sick. And there's a social media little needle point that's going around that says that which does not kill you mutates and tries again, that this virus is not stopping. It's changing. We're seeing new variants pop up, and the weather, this really is a virus, a seasonal virus, in the sense that it's a virus for all seasons. If you look for coronaviruses, you can get a cold in the summer, you can get a cold in the winter. COVID is no different. It's a coronavirus. It's a novel coronavirus, which none of us have been exposed to in our childhood, which means that it's more severe illness for us. And that's what's causing this to be a problem. And it continues to pop up. We're seeing spikes happening across the country right now. And the warm weather, again, just doesn't have it. It really doesn't make it go away like we hoped it would be during the summer and the spring. But it is primarily spread by the air. We're no longer wiping down, or most people at least aren't wiping down their groceries when they get them from the grocery store. They're no longer letting mail sit out for a week before they can open it. It really is identified that this is something that's spread person to person through the air. And when you have groups get together, that's when you have your biggest risk. So masks, testing, vaccines are really what's going to allow us to keep people out of the ER, keep them out of the ICU, keep them healthy and able to continue going to school. Because I think the other thing that we really learned was kids need to be in school. We need kids having that education. It has social, it has mental health, it has the educational benefits, and we really want to make it accessible and safe as possible. But we are going to have cases pop up, and to look for that, we need to have tests that are available that can identify people that are potentially infectious, those that are infectious, and make sure that they can stay home and not be a risk for spreading and causing uncontrolled outbreaks in your school environments. Lastly, I want to point out that one of the other big lessons we learned is that there are health disparities. There are multiple types of disparities across this country. And while COVID didn't cause them, COVID really elevated them in prominence and really highlighted some of the disparities that we have across our country. And I think telemedicine and the testing protocols and this effort that we had where you could go anywhere to get a test provided, you can get treatment, it really provided a level of care that our country has not seen in a long time. And realizing that there are measures we need to take these measures seriously and to make it available to everyone, because it really is on all of us to take a measure, to get tested, to take those precautions to avoid spread in the future. Next slide, please. So in children, again, as I said, this affects every age group, and children are not exempt. Earlier in the pandemic, we believed that kids weren't heavily impacted by this, but that was largely because we had shut down schools. We had closed down the country. Everyone was staying at home, and we really saw very minimal transmission. On the graphs on the right, you can see our levels going back to March and the spring and summer of 2020 were pretty low. I mean, relative to what we saw this past winter, they were pretty low. And those were the ancestral and what we call the alpha variant. Going into the fall of the spring and summer of 2021, we started seeing the alpha and the delta variants emerge. We had increased numbers. Transition to the fall, delta really gave way to Omicron. And that big spike that we have on the right-hand side is the Omicron variant that had just a new level of transmissibility that was allowing it to infect people as a jump person to person very, very easily. But what's also different about fall and winter of 2021 is that we had resumed normal activities. And this is what we could have had happen if we had seen as many cases pop up on that far right column a year earlier, before we had vaccines, before we had therapies. The death count that you see on the bottom would have been off the charts. We would have overwhelmed the health system, and we would have had much more severe disease, including in children. So we really thank everyone for taking those extraordinary measures to help not overwhelm the healthcare system, the hospitals, more than they already were. And really appreciate all the effort we had to try to limit the spread. Remember, flatten the curve terms. We really did a good job of that in the early days of the pandemic. And then once the vaccines were made available, it really reduced the number of people that needed hospitalization, the number of people that got admitted to the ICUs, and the people that died from this disease. But children are heavily impacted. And I'm very happy to see just today that the FDA and ACIP have approved the FDA has approved vaccines for our youngest children. And as early as next week, we will actually have vaccines available for all age groups, with the exception of those children, neonates under 6 months of age. And that is going to be one of the best measures we can have at preventing spread of this virus in schools, in our communities. And while it doesn't do always a great job at preventing the spread, it does a great job at keeping out of the hospital, keeping out of the ICU, and preventing deaths unnecessarily from this virus. But when you look at the AAP reports, 23 million children have tested positive for this. And the big unknown is the next bullet point that talks about long COVID. We don't know, because this virus is so new, what the long-term impacts of this pandemic or this virus may have is on individuals. Neurologic impacts, cardiovascular impacts, muscular and skeletal impacts. This is an unknown, and we want to make sure that we're protecting children and not causing unnecessary infection that could be prevented from this virus that may lead to adverse outcomes that we can't even predict at this time. Go to the next slide, please. So when we look at the schools need safe, reliable, convenient testing. They want to have flexibility. You want to have the ability to have school occur, not be disruptive, having kids pulled out every couple of days for weeks at a time, or having teachers out sick frequently. We want to make sure that we have your schools up and operating. And fortunately, Bloom does offer easy ordering and testing, so you can get the supplies you need. The tests are easy to administer, or have staff available to administer them for you and facilitate that. And then also education and outreach and training for everyone on how to actually implement and roll out these programs. It really, Bloom does a nice job of bringing this all together under one roof. Next slide, please. And there's not a one-size-fits-all test for all scenarios. We have a selection of PCR testing, pooled PCR testing, and antigen tests that are available to meet a variety of needs. And we can talk about the different special scenarios under which some of these may be beneficial or kind of the best solution for your question. But the antigen tests, I understand, are very simple to administer. I've used them in my own home. Bloom has a supply of a variety of different products, including Bionex Now, and these can be ready to go or give a result in as little as 30 minutes. Pooled testing is great for large groups, and you want to do rapid testing to find out quickly if the whole school group or a sports team is ready to go and safe to compete. And then PCR testing is really great for individuals to identify as our gold standard who actually is infectious or who's infected at a certain point in time and has high sensitivity and high specificity. But not all of them, as I said, are the best solution at all times. While PCR really does have a high sensitivity and specificity, that sensitivity can be kind of a double-edged sword, because if you don't test the child early in their course of illness, you may be getting them after they're past their infectious window. So when you look at this kind of a graph, in that first 2 to 3 days, when that gray section is in the incubation period, they're just testing up, ramping up the virus, and it's growing in the body. As you enter the infectious period, there's rapid growth of the virus, and then your immune system starts to respond, and the virus is blunted and starts to come down as your immune system starts to fight off the disease. That's when you start really feeling sick, run down, feverish, other types of runny nose and sick feelings. PCR can test when you have very, very little virus present, but you're not considered truly infectious to other people or a risk for spreading it until you have the ability or enough virus in your body for it to be spread out to others. And the antigen test can be really good at detecting that limit. And the antigen tests stop testing positive after as little as about 10 days, typically as a window. But when your antigen level, which is measuring proteins on the virus, when that drops to a certain level, there's a possibility you're no longer infectious, but you're still going to continue to test positive on PCR. So if you're relying on the PCR test, you may be advising kids to stay out of school longer than what might need to be necessary based on their transmissibility and risk to others. Next slide, please. So when you look at lab pooling, there's options from other industries called pod pooling, where they would collect samples, they'd put them together in a single test tube on its own, and then they test that test tube in the lab to find out if it's positive or negative. The problem is if you go the pod pooling approach, you have to go back and swab people again to figure out which one of those 5 people was positive in that pod. Whereas if you do lab-based pooling, each individual gets swabbed with a nasal swab. It's taken back to the lab, and at the lab they take a small amount of the sample from each of 5 people into one test, and they can retest each of those individuals if the pooled sample comes back as positive. So you get a quicker result with less inconvenience and less swab for the families or the individuals. And it's a quicker turnaround in general because you're not waiting to find that in that group of 5 people to test them all over again. And there's no delay. And then the antigen tests, as many of you are familiar with this, these are rapid tests that can be performed at home. They can be performed in the clinic, and they typically involve a swab that goes in the nose. You place the swab either directly into the card like Binax Now, or into a vial of solution for some of the other products, and then drip out and have a result come in a color changing little strip to identify if someone is positive or negative. Again, not all that sensitive if you're later in the illness when not as much antigen is present, but it's really good at identifying individuals that are highly infectious and a risk to others. So I'm going to pass it over to our operations director, Tanya.
Thank you, Joe, and thank you everyone for joining this session. So let's talk about, just the ease and flexibility of testing and the support that Bloom can offer. So here at Bloom, we are committed to creating, a seamless and efficient and convenient experience to all of our clients. Thus, working with you to create a testing program or options that fit your school's needs. And by doing so, we can offer on-site trained staff, as well as online ordering and support and access to your results via our web-based portal. Next slide, please. Thank you. So just to go over start to finish our onboarding, from onboarding to results, we have 4 easy steps to sign up with Bloom. First, it would be signing up via phone or email. And then we also have an option where you can sign up via our online sign up form that can be sent to you by our ordering manager. Step 2 would be registering. So complete registration for all parents, students, teachers, and other faculty can be done via our Bloom web portal or via phone. Step 3 would be the setup. So coordinating with our ordering manager and team to create an ideal testing site, or simply by placing an order for testing supplies. And we'll go over more of those options with you here shortly. And then lastly, once your samples are collected, received, and processed, you would then receive your results via our portal. And you can also receive those via text and email as well. Next slide, thank you. So we've made it easy to get started. For signing up, you can choose from 3 convenient options. Again, via phone, email, or completing our short sign-up form that can be sent to you by our ordering manager. And then once you're onboarded, the process from end to end is completed within a 2 to 3 day time frame. Next slide. So our ordering manager setting up, all you have to do is reach out to our ordering manager. She can assist you with setting up a customized testing plan. Our trained staff can assist you with training your testing personnel, or we can provide you with trained Bloom testing personnel as well. We can also help identify your needs and securing a secure site for testing, as well as storage locations for those supplies. And because staff is included as an option, just to piggyback off what Cole had mentioned earlier, we can set up testing options where if you want to do a drive-through test, or we can set up location, a specific centralized location for you, or to set up testing at various schools within your ISD. That way it's centralized and easily accessible. So again, placing an order to keep it easy and convenient. We're committed to respond to all of your requests for orders within 24 hours. And again, we offer PCR testing, on-site trained staff, pool testing, as well as rapid antigens. Next slide. Thank you. And as far as support materials, we provide those to you as well. And those are available to you in English and in Spanish, and those are for you to be able to pass out to any parents, your faculty, as well as the school nurses. Next slide, thank you. And so for registration, again, setting up with our ordering manager, the registration process is super easy. What you would need to do for the registration is just making sure that you have accurate and up-to-date information provided to us. That way you have easy access to all your testing results. And then those forms are, registration forms are available to you as well with the training materials in English and Spanish. Next slide. Thank you. All right. And so sample collections are administered by Bloom staff or by the school nurse, and we coordinate pickup and transportation of sample collection via various means. Next slide. And reporting of those results, just to go back to reporting, again, easy and accessible for you via our online portal to review. Other ways that you would be able to receive your results would be via text or email. And again, it's just, I can't stress enough the importance of just making sure we have up-to-date and accurate information. That way you have your results delivered in easy and fast. Next slide. Perfect. Thank you. And so what have we learned in the past year? By utilizing Bloom, we provide, again, trained on-site staff that are available to assist with your testing and registering of all participants. That's providing a stress-free and personable approach. We take pride in just making sure that we are communicating effectively and doing so and providing that exceptional customer service. And the ways that you can get in touch with us to place orders would be, we have our Zoom support hours, which would be every week on Thursdays between 10 a.m. and 12 noon. We are available via phone by reaching out to us at the number provided here. And that's Monday through Friday, 8 a.m. to 8 p.m. Or you can reach out to us via email by emailing us at the Texas K12@bloomhealthpartners.com email address.
And one thing I would add to that, Tanya, regardless of if you are ready to place an order yet or not, please reach out to our team. We're available all summer long. We can answer any questions that you might have and work with you to really develop a customized solution, because again, every organization has different needs and things that need to be considered. So we're more than happy and we're available to collaborate with you to provide a solution that makes the most sense for your school district and even down to individual schools. And I'd also remind you that we know this has been a strain on your district's resources. So we want to try and make this as easy as possible for you, all the way down to us providing our nurse staffing on site so that your school nurses and other resources from the district can get back to focusing on their normal day-to-day jobs, and let us come in and take care of any testing and staffing needs. And also just a reminder that we're born and bred here in Texas. Our headquarters are in the DFW Metroplex. So we're happy to be supporting our home state here, and we have offices not only all over the country like you saw in the video, but a number of different offices throughout the state, so we can support districts in any part of the state. So I'll just close with that, and Damon, I'll hand it back over to you.
Great. Well, thank you all so much. Now we're going to shift into our Q&A segment of the session. I think we already have 2 questions in the Q&A feature. The first one is from Susan Kaufman. It says, what do we do with our old tests that the new vendor may not offer? Good question. So I want to make sure I'm understanding. You're saying, so let me say this. Generally speaking, if you have any tests that are not expired, then you want to keep those tests unless there's an issue with reporting those. But if you have tests that are unexpired and they can still be reported to the vendor portal, then you still want to use those tests. Diane, if you want to jump in there to clarify or to add on to anything, I want to make sure I'm giving accurate information.
Yes, I do. And Susan, if we haven't answered your question appropriately, then either elaborate on it or you can ask us. But what I think you might be asking is if you have tests from one vendor and you want another vendor staff, that new vendor staff cannot administer the old vendor's tests. So Bloom comes to you, their staff comes to you, and they are to administer tests that you got from Bloom.
Okay, that makes, and then I think someone also in the chat is asking the same question. So if switching vendors, what do you do with those tests? Okay.
I want to jump in and just clarify something here too. It's not just the antigen tests. So part of the PCR testing as well, it's specific to the collection device. So the tube that the swab is being put in, if it's not compatible with Bloom's test, then we wouldn't be able to process those specimens. So it's important that if you're switching vendors, that you communicate with Bloom to make sure that you have the correct supplies on hand so that you don't have any delay in processing your samples.
Right, and for us, it goes back to the reporting mechanism, because we know that one vendor sent the school, will say 100 tests, and so we should be hearing from that vendor about the school reporting those 100 tests. And if you've got another vendor doing the reporting for tests you receive from someone else, it really muddies the waters.
Got it. So I'm gonna jump to the chat. There's a question, and then I'm gonna jump back to the Q&A. Can we still partner with 2 vendors? Yes. any school district, public or private, is open to partnering with more than one district. With that said, you are still responsible to meet the requirements of each of those individual vendors. And so the more vendors you take on, that's fine, but you still need to meet those individual reporting requirements and make sure that you have all you need to be in compliance with those vendors and their testing protocols. So that's my general answer to that. If anyone from Dishes wants to add on to that, you can. If not, I'm going to jump to another question. Okay. Next question says, what is the cost of staffing for on-site rapid testing per hour?
Yep, so our cost per hour is $78 per hour, and it's a minimum of 4-hour blocks. So what we found this past this past school year, or at least since January, working here in Texas, we had a lot of schools that would utilize our staffing in the mornings from say 7 to 11 a.m. To catch any potential symptomatic students or staff early in the morning or at the drive-through sites, same thing, first thing in the morning. And so that's typically what we saw was people utilizing those 4-hour blocks in the morning time, and that cost is $78 per hour.
And with that said, before we conclude the session today, I'm going to walk everyone through the TA website so that you can see we've already posted the current vendor resource chart or vendor resource sheet for next year. It'll be updated again, but we already have the current one and then the one for next year posted on our website. So I want to make sure folks know where to go to look at that so you can begin to plan. Diane or Dishes, I think this question I want you to definitely answer this one for us, and it's in the chat. It says, so can we get staffing from one vendor and tests from another vendor?
No, you cannot.
Got it. So just to reiterate, if you're testing with vendor A and Bloom, you would need to use, and you're wanting staffing from Bloom, you'd have to get staffing from Bloom for those tests, and then for vendor A, staffing from vendor A for those tests. So you can have two vendors, but you would have to have separate logistical practices going on for both in terms of staffing and testing for those. Hopefully that answers your question.
Yes, that's correct. And if
Got it.
anyone needs to have a more in-depth discussion about that, they can contact COVID case report at tea.texas.gov, and then we can delve further into that.
Got it. Gonna jump back into the Q&A feature. It says, how are POC's tests reported to Bloom and TEA? Will reporting to Bloom require additional data import from our district?
Great question. And I think this is something that we've received from some of the school districts that we've worked with. Of course, we all know that there are a number of districts that were placed on a blue list. And so from a reporting perspective, and Diane, feel free to jump in at any point, but from a reporting perspective, if Bloom is providing you with rapid antigen tests, Binax Now tests, you still need to, and if Bloom is not providing nurse staffing, I should caveat. So let's say your school nurses are administering the tests, those results still need to be reported into Bloom's portal. And our team is happy to walk you through that, step by step to make sure you're comfortable with that. And then via our portal, Bloom reports those results to the state. Now, if you are utilizing our staffing on site, then our staff will administer the test, record the results in our portal. It's the same portal, but our staff have a different access, but it's the same exact portal. And then those results get reported to the state, in the same manner. And then I think separately, there is a weekly report that's not necessarily the results reporting, but a report that the schools, and districts submit to Dishes about what services the district received from each vendor from the prior week. So I think there might have been some confusion regarding what the reporting requirements were of the schools. So I hope that clarifies it. And Diane, I don't know if you want to jump in and add anything else.
Certainly, I would like to. Thank you so much for your explanation, Cole. So just so that everyone can distinguish between the differences of results reporting, there's some things to remember. So first and foremost, when you have a positive case of COVID in your school, you're required to report that to your local health department. Just like it would be if it was measles or any tuberculosis or any of those other reportable diseases, you're required to notify your local public health department about that case of COVID. So that's reporting case number one. And of course, the child's name and other information is required to be reported. So that's number one. Number two, reporting is called COVID case reports. And that is on the TEA website. And that was a mandate put in place last year by the governor because we were getting questions about, well, how many children who are in school are testing positive? How many fourth graders are there? How many kindergartners are there? And we didn't have that information. That information was not from the first type of reporting that I talked about. So DSHS developed an online reporting mechanism for schools to report their information. And that's where you go to the website and you say, this is a student or a staff member or an adult who visited the school type of thing. You're putting in the grade and all of that information. That's reporting number two. And then the third type of reporting is what is required for grant reporting. What is required for grant reporting is that the vendor tells us how many tests were sent to the school. So Cole sent you 100 tests. And then using Cole's portal, when those children are tested, it decrements out of that portal. And on a weekly basis, Bloom sends us information back. And it says school A, there's no identifying information except for the school, the district name. And it says school A used 25 tests and there were 3 positives. That's all it says. And that is grant reporting requirements. But when you're using Bloom's portal, it becomes Bloom's responsibility to notify DSHS. So it wouldn't be the school's individual responsibility to notify us as to how many tests you used. But if you are not recording it in Bloom's portal, therefore Bloom knows nothing about it. Therefore, Bloom is not telling us about it. When we look at the numbers, if Bloom tells us they sent you 100 and you've not reported anything, we think you still have 100 on hand. So when you ask for more tests, we're going to say, well, wait a minute, you still got 100. And then usually it goes back, it says, no, I tested these children, but I never reported them. Well, you need to get your reporting up to date so that you're more than 80%. That's what results holds means on the TEA website, that more than 80% of the tests that you received have not been reported, either as used or expired, and the expired number should be very, very low because this program hasn't been in place for very long. So that's the 3 types of reporting. And many, many times they get confused and meshed in with each other.
Thank you for sharing that, Diane. And what we're going to do too, because I know many people are visual learners and going to need to refer to documents and so forth. We're going to be putting out guidance and a ton of information. And so that'll be coming out within the next few weeks so that it's very clear about what the reporting requirements are and what needs to be done. So thank you for your questions. Let me go back up. That one was already done. Is there a video demo of the portal use we can view?
Yeah, we could, I would encourage you to to call the phone number here and ask for Tanya, or if she's not available, and we can do a screen share. I know that was really helpful, so we could set up a time for a Zoom or a Teams meeting and walk you through the portal step by step. You could also email our TXK12 @Bloom Health Partners email address and request a walkthrough, a demo of the portal.
Okay, great. Thank you so much for this, sir. For Bloom Portal, not this is part. Okay, vendor reporting has been okay. Got it. Okay, you answered that question. Got it.
Damon,
Go ahead,
there's
Diana.
one more question that Diana Rios Rodriguez asked, that what if we never got set up on the portal this year? And so you would need to contact Bloom about that, because that's where your use of tests needs to be reported. And Diana Rios Rodriguez is from Manor ISD, MANOR.
Thank you, Diane. We'll reach out. We'll reach out to you, Diana.
Perfect.
Yes, we made note of that. Thank you for letting us know, and we'll get you set up.
Got it. So please continue to drop your questions into the Q&A feature, to the chat. While you're doing that, I'm going to share my screen so that you all can see on the website where some current information is posted. So let me go ahead and share my screen. Can you all see my screen?
Yes.
Perfect. So this is the TEA COVID-19 support website, and I'm going to drop this link into the chat. But if you go to K-12 COVID-19 testing project, it shoots down to this part of the page. And a couple of things. Our FAQ, which is right here, this will be updated for the new year. So you'll be able to go here and have a new FAQ updated, and we'll put the date of when it's posted so you'll know when it's most current. The other thing I wanted to share, I mentioned earlier, was the new vendor resource sheet. So right here, we have two of them listed. We have the current one, 2021-2022 vendor resource sheet listed. And then we posted on Monday, the new one, the 2022-2023 vendor resource sheet. It will be updated again. And as it's updated, the date that the update is made will be included. But this is where you would go for everything that you want post August 1. So this second one, 2022-2023, those offerings don't start or not effective until August 1. Right now, we're still under the 2021-2022 vendor resource sheet. And then outside of that, as I mentioned earlier, this webinar has been recorded, and their slide deck will also be posted. And so that would be posted right here under webinars and presentations. And so you'll see it, it'll be labeled, and then the date will be next to it. So this is where you can find that information. I'm going to copy this link. I'm going to drop it in the chat. So let me stop sharing. And I've just dropped in the chat that link to that website so that you can see all those postings. With that said, we're still looking for any more questions in the chat or in the Q&A feature. And then if anyone else from Bloom has anything else you want to offer or clarify in our remaining time, please feel free to do so.
I would just like to add, thank you, Damon. Would just like to add, if there's any questions that anyone has, is not comfortable, on live, please feel free to reach out to us. I know we had a few last night and this morning that I was able to answer. Just call me anytime. I will make sure that you guys have my phone number directly, as well as we can be reached at the TXK12 @Bloom Health Partners. And so we can assist you with any questions you have to get you guys set up. Thank you.
Thank you for that. Anyone else with any questions, or anyone else also from Dishes, if you all wanted to jump in and add anything that you feel is pertinent to today's conversation, please feel free to do so. We have about 15 minutes left allocated for this session.
This is Diane. And Cole, I didn't know if you wanted to address with the group to notify them of the changes that you guys made to your offerings for next year. And if you need some prompting, I can help you with that.
I would appreciate that, Diane. I think I've got the vendor resource chart in front of me on my phone. So if you have it in front of you on your computer, it might be helpful if you could prompt me on that.
I do. The price of Abbott by Next Now and Quick View Rapid Antigen.
Yep. So those are both now $19 per test. Abbott by Next Now, there's a minimum order of 40 tests, because as many of you are probably familiar, those come in boxes of 40. And on the Quidel Quick Views, it's $19 per test with a minimum order of 25 tests. And I should say, we probably need to clarify, and this would go for all the vendors, I would imagine, it should not only say minimum order of 40 tests for Binax Now or minimum order of 25 for the Quick View and indicate, but as you go above that minimum order size, it needs to be in increments of 40 for Binax Now, because we can't separate boxes. So we couldn't provide 45 tests, for example, because those boxes on the Abbott Binax Now specifically only have one or two solutions in each box. So we can't break those up into smaller increments than 40 for the Binax Nows, and then for the Indicade and Quick Views, 25 tests per box. So those need to be in increments of 25 for your orders.
That's a great suggestion, Cole, and I will take that suggestion and update the vendor resource chart to reflect that. So thank you so much.
Sure
and
thing.
Just so that everyone knows, that was a reduction in price for the Abbott Binax Now and Quick View from Bloom. And then how about TagPath individual PCR?
Yep. So going back to that, we were able to reduce the pricing on the TagPath individual PCR. And so that's now $100 per test with a minimum order of 25 tests. I believe previously we had the price a little bit higher with a lower minimum order, and based on feedback that we received, and just based on the order flow from since January, I should say, it seems like this makes a little bit more sense because people were ordering in larger quantities. So we were able to reduce the price there, and that includes overnight shipping both ways. So if you get a hold of Tanya or one of our other team members today to place an order, those would be shipped out, more than likely, if it's before the 5:30 shipping cutoff that we have. Those would be received by you tomorrow if you're not within one of our local service areas, because we also have done a lot of hand deliveries using our courier network. So but I would say good rule of thumb, if you place an order today, whether it's PCR or the rapid antigen tests, those would be sent out overnight and received the next day. So
and Cole was just using today as an example, because ordering for tests for the schools has it closed on May the 20th.
Thank you for keeping me honest, Diane.
And then Cole, the next one for lab pooled PCR.
Yep. So lab pooled PCR, very similar. We were able to reduce the cost per participant. So that's $27.50 per participant with a minimum order of 25. And again, I think Joe did a great job of explaining the difference between lab pooled and then what's referred to as pod pooled or sometimes source pooled, where they're pooled at the source. We just feel like it's more efficient to do lab pooling because if a pool does show up as positive, we have those individual samples that can be run again right there on the spot in just a few hours, as opposed to with a pod or source pooled, you would then have to go back and retest those individuals. And if that happened on a Friday, then you've got a pool of folks that are out and about over the weekend, and somebody or maybe a few people in a pool are positive. And so we just feel like lab pooling is more efficient.
Perfect. And then just so that everyone knows, there will be a new vendor resource chart posted again this Friday or Monday. And what I've done this year is to put a synopsis at the bottom to identify the things that changed between the 21-22 school year and the 22-23 school year, so that you can quickly identify the changes. Thank you so much for that, Cole.
Thank you.
Yeah, thank you both for that clarification, and Diane, the synopsis piece at the bottom of the new vendor resource sheet. I know that's going to be very helpful to schools. With that said, I'm gonna give about another couple of minutes for any more questions, and if there isn't anything, I'll give some final words to Bloom, and then we'll conclude today's session. All right. I don't see any more questions, and I think that was some decent teacher wait time there. So just, as a former teacher. With that said, Cole, if you want to go ahead and conclude it for us today, you guys can have the final thoughts.
Yeah, well, again, thanks to, Damon and your team, at TEA, and Diana and your team, at Dishes, for all the, hard work you've put into this program over the last, year, and, and continuing to support this program. So we appreciate, you and your teams for all the work you've done, and want to thank the participants. And, I know I've touched on it, Tanya's touched on it, but really we pride ourselves in our business on, a high level of customer service. And we think the fact that, we serviced a lot of, large Fortune 500 companies, television and film studios, and, there's something's working, but again, don't hesitate to call, reach out to us. Tanya, other members of the team are available to walk you through any questions you might have. If you're not feeling comfortable, asking them here on the webinar, we're happy to jump on one-on-one calls. There's no charge or cost to that. And we can come up with a solution for you, because again, we know everyone has some unique needs, and we've been able to think outside of the box to deliver some unique solutions to hundreds of other organizations in a variety of industries. And we just in this last school year have a lot of experience doing testing for schools. So don't hesitate to reach out. We'd welcome the conversation, and happy to see how we might be able to support you going into next school year, keeping the kids in school, and also easing the burden on your staff and resources. And just leaving some of this COVID stuff to us, so you all can get back to keeping the kids educated and everyone safe. So that's all from our end, Damon.
Thank you all so much. Thank you to Bloom. We're looking forward to working with you all to continue to support schools, public and private, throughout Texas. With that said, thank you to everyone that's joining us, and we'll be in touch soon. See you all. Thank you so much. Bye.
Thank you.
Thank you.